All right, so what we're going to start talking about now is some of these adaptations at actual high altitude. Uh, just to remind everybody, we've been kind of looking at what happens when we go up in altitude, just kind of in the short term. Now we're going to start really taking a look at what happens after you've spent some time at altitude. Just to remind everybody, this is this little sheet that we keep having in here for the abbreviations because there's a lot of partial pressures, especially this stuff at the bottom. We start to talk about this quite a bit in terms of partial pressures of inspired and everything else like that. So one of the things I do want to say about acclimation, and depending at the altitude you're at, getting used to this altitude, acclimatizing to altitude will help anything you're doing there. But in reality, if you're at a high enough altitude, you're not probably going to be able to get these adaptations to get to the level that they're going to match what you might have been able to do at sea level. We're definitely going to see pulmonary, cardiovascular, skeletal changes. And these ones, it's really a matter of about 3 to 4 weeks of at moderate altitude. If you're going to get some of these changes, as you go higher up, you're going to need more time for every 600 meters, that's going to be about another, for every about 2,000 feet, you're going to need a little bit more time. And this is stuff that will stay with you for a little while after you return back to sea level, but within about a month, you're going to be back to kind of your pre-adaptation levels. So this is going to kind of give you an idea, and I'm going to have this slide in here a number of times. This is kind of letting you see the summary of all these ones here. So we're going to definitely see changes in ventilation, red blood cells, hemoglobin content, plasma volumes, as well as some of the more metabolic stuff with capillary density, and how our muscle fibers look. So definitely one of the things we're going to see off the get-go here is we are going to see adaptations to ventilation. What we're going to see is definitely increased rates of ventilation. Again, this is a little bit more of a short-term change. We try to start making up for this a little bit more long-term as we go. But this is definitely a little bit more in the short term here. So increased ventilation at rest as well as some maximal exercise. Over about 3 to 4 days, we're going to see rates that are almost 50% higher than sea level. And again, the longer time frame, this will be even a little bit higher. So this is kind of showing you how it's increasing within just, like it says, ventilation increases in a few hours after getting there. But if we're looking at this, the ventilation rate after days residing, you can see the ventilation rate is going to go up for about those first 3 to 4 days and then kind of hold steady. And again, what this is doing by having an increased ventilation rate, we are pulling more oxygen into the alveoli, which is going to give us a higher level of saturation in the arteries and also allow us to get rid of more CO2. In a way, this is not actually the best thing in that this isn't going to increase our blood pH. For blowing off more CO2 than normal to get that oxygen, it does start causing a change in blood pH levels. And you can see here the open is the the open is the acclimated level right here. So you can see CO2 levels at different partial pressures. You can see after we've acclimated, there is definitely less CO2 at any particular partial pressure. One of the things we can look at here is we can also kind of compare some of these folks that have been born and raised here versus people that come here and acclimate. So native Highlanders, they generally, due to their structural differences in some of their lungs, have better blood flow, less dead space, and tend to have a better diffusion capacity than these folks that come here and acclimate. So acclimated lowlanders, they generally don't see this change in this pulmonary diffusion capacity that you would see to people that have been born and raised there. So this resting ventilation, increased ventilation, is really related to hypoxia. It's not actually the high levels of CO2, it's actually going to be to hypoxia. So you start breathing more because you're hypoxic, not because you're having too much CO2. And again, this means that we are going to have some changes in those pH levels. Additionally, hypoxia is going to give us a lower cerebral arterial saturation of oxygen, which again is going to stimulate more chemoreceptors to increase this breathing rate. How well you respond to this is really a number of different things that involve this. Obviously, there's going to be some genetics. Some people are just better predisposed to being at these altitudes. How severe is the hypoxia? Are you at moderate altitude? Are you at higher altitudes? How long have you been there? Some of this as well, if you were brought to one of these areas as a lowlander early on in your life, you might be able to get some of these more physical changes that are more similar to those native Highlanders. And again, also, are you stressing the system even more by doing exercise or physical activity at these levels? So this is kind of looking at oxygen levels versus ventilation. And you can see these native Highlanders, they don't need that same high level of ventilation in order to deal with the decreased oxygen levels. Where you can see non-native Highlanders, ones that have acclimated, as well as lowlanders, you can see when they're going out here, as you start getting these lower levels of oxygen, these lower partial pressures, their ventilation rate has to go up greatly to try to deal with this. So these native Highlanders, because of other pulmonary diffusion changes, do not have to sustain such a high ventilation rate in order to maintain their oxygen levels. So the longer someone is at this, so the higher altitude exposure, or more years of altitude, it will increase the level of CO2 necessary for that increased ventilation, and it will lower the oxygen set point for that. The other thing we see is when we're doing any type of exercise, the ventilation rate at subacute levels is going to be higher than it would be at normal oxygen conditions, at those normoxic, as they call it, conditions. Submaximal exercise, you're going to have increased ventilation rate over normal conditions. And this is kind of showing that even at rest, in your hypobaric, you can see even at rest, increased ventilation rates. As you start doing more activity, those ventilation rates are going to go higher relative to sea level. So you can see much higher as you start talking about the duration at hypoxic conditions. And this is going to be true of both native Highlanders as well as acclimated folks. Both of these are going to have increased ventilation rates due to exercise at altitude. Again, one of the things that becomes an issue as we're here, this increased ventilation rate that we're starting to deal with this, it is going to cause us to blow off more CO2. When we blow off more CO2, that is going to shift those hemoglobin saturation curves that we've talked about. You're getting rid of more hydrogen ions. It's going to give us a more alkaline blood. It's going to cause a shift in that hemoglobin dissociation curve to the left. It's going to give our hemoglobin a higher affinity and really doesn't let us release as much oxygen to the tissue. So this is going to start becoming a little bit of an issue. This is a short-term issue though. Over a few days, what we're going to see is our kidneys start becoming more active at excreting more bicarbonate ions in order to normalize this blood pH and shift that back to those normal levels. Again, this does require more urine formation. It also requires more water intake to allow this to be able to happen. And this, again, just to remind you, is in the blood we have these bicarbonate ions. When we're blowing off more CO2, we are going to end up with more bicarbonate ions that we need to actually get out into the urine. So that is the big issue with breathing due to hypoxic conditions and not carbon dioxide levels, is that we are going to start shifting our pH and start shifting some of our hemoglobin saturation curves. Another thing we're going to see early on here is some changes in 2,3-DPG. That increased ventilation is going to stimulate the red blood cells to do glycolysis, and that lower level of oxygen, those lower partial pressures, are going to stimulate increased 2,3-DPG levels to increase. And again, that is going to shift that offloading of oxygen at that muscle tissue to help out. So that's going to help shift this back to the right. The shift in this curve to the right is going to help unloading oxygen at the muscle tissues, but not really mess with anything with the onloading of that oxygen at the lungs. But we can, by increasing more of this 2,3-DPG, increase our release of oxygen to the tissues. And again, these adaptations it's going to be within about the first 48 hours of high altitude exposure where we're going to start seeing these changes in excretion and changes in the levels of 2,3-DPG. Again, exercise that's going to decrease this will shift that curve to the right, and that will also help deliver more oxygen to the muscles when you're having issues with that. So that is our first little show here. We're going to start talking about some more of these changes as we continue on. I'll see you next time.